was the Apple Watch, and that first came up with the diagnosis. It told me that if this wasn't a normal function for me, I should report it to my medical professional. So that's where it all started from.
If you have a condition called aortic stenosis, which is unfortunately a condition of increased maturity, whereby your aortic valve, which looks like a Mercedes-Benz sign, becomes calcified along the lines of that, and therefore it can't open properly. And that therefore causes additional strain to the heart and causes symptoms of breathlessness, chest pain, and sometimes, unfortunately, blackouts.
And latterly, I'd get to the top of the stairs and I was absolutely breathless. It progressed fairly slowly, but I just had got no energy whatsoever.
TAVI stands for Transcatheter Aortic Valve Implantation, and it's a procedure where we make incisions in the upper leg using a very fine tube, which is called a catheter. We put a new valve on top of your old one. And what this does is it immediately relieves that narrowing or restriction that you have across that valve to resolve the problem of blood being able to flow freely out of your heart.
We get your referral into our office and we will ring you to make an appointment for you to come and see us in TAVI clinic. The first thing we'll do for you is a full set of OBS, blood pressure, height, weight. We'll do an ECG and we'll take some bloods from you. And then if the consultant feels that it's something that you will benefit from and you're happy to accept the risks of that procedure, then we will accept you for the workup phase of the pathway.
And generally we'll ask you about how you feel, what your outlook is and where you're going. It is not an examination. You're not trying to pass to get a treatment. We are trying to help you, and if we feel that in any way that we can, we will offer you that opportunity.
He explained that they felt that my arteries and that my heart was badly calcified, that I would probably benefit from having this TAVI procedure.
When you're being so-called worked up for a TAVI procedure, one of the most key tests is to have what's called a CT scan of your body. And what that does is it scans you from about your neck down to your mid-thigh. And what it does is it really gives us a roadmap of your internal anatomy.
So I had a scan where they used a dye. They had to ensure that I got a route through my arteries to the heart, because that was the route that they were going to go. They were going to go in my right groin.
It isn't just any old CT scan. It is done according to what we would call a TAVI protocol, so that the TAVI operators will study those scans in tremendous detail and do all the measurements themselves.
A workup usually includes a lung function test, where the anaesthetist gets good information about what he can expect during your procedure. Very occasionally, if you do present with some chest pains, you may need to have an angiogram, which is basically a contrast test to have a little look at your blood flow into your heart muscle. And then your case will be discussed at our heart team meeting or multidisciplinary team meeting. And we will look at all of your imaging to see whether or not it is technically possible to deliver TAVI and that it is still the lowest risk way to replace your valve for you.
We take the entire expertise of the institution to decide what's best for you as a patient, which will give you the best long-term outcome with the lowest risk and the lowest disruption to your life.
We will phone you usually the following day to let you know what the outcome of that MDT is.
Usually it's good news. We can deliver the valve for you and you will be invited to a pre-assessment clinic. During the pre-assessment clinic, we do again a set of observations and explain to you what to expect when you're in and having your procedure done before you go home and discharge.
You will be advised on what medication you should be holding for the procedure. We obviously stop proper blood thinning medication, be it warfarin or apixaban. We will tell you individually what is right for you to stop taking those medications and when to restart them after the procedure. You will be given some skin preparation to use. So there's a shower gel that you will use once a day for 5 days before the procedure, and also a nasal cream. That's really to treat or to prevent this hospital superbug, MRSA.
We usually expect you to come into hospital onto the ward at 8 o'clock in the morning. If you live a bit further away, we would like you to perhaps come in the night before. You will not be able to have any breakfast, so you will be nil by mouth. You're usually only allowed to drink water, clear water, up to 2 hours before your procedure.
We will have shaved both of your groins and your wrists if you need them, and pop you into a pair of our glamorous paper knickers and one of our gowns ready for the procedure.
On the day of the procedure, the interventional cardiologist who will be doing your procedure will go through the risks and benefits and the percentage of each of these with you in detail, so that we get informed consent prior to you having your TAVI procedure.
He said it would be extremely busy. He said there might be 12 people in there. Don't take any notice of them. He said they've all got their jobs to do. I was a bit more relaxed when he actually told me that.
First thing we do is we put a flexible tube in your upper leg. Once we have that flexible tube in position, we use wires to get to the heart, using those wires as railroads in essence, where we can position the new valve on top of the old one that's diseased and not working as well as it should do.
The amount of X-ray that you're subjected to as the patient is actually quite modest. The operators will be wearing heavy lead coats to protect them from radiation, because they're exposed to rather more radiation because they're carrying out these procedures most of the working week.
TAVI procedure is performed in all patients under local anaesthetic. However, in addition to this, you may receive some sedation that will ensure that you're comfortable and that you don't feel pain throughout the procedure.
Well, they told me that I'd obviously, I wouldn't feel any pain at all, but I'd feel them prodding and you know, sort of generally I would get that sensation because obviously I was awake. But there was no pain whatsoever.
We've got all kinds of measurements that we're performing for you. We have a whole team dedicated to making sure that all of these separate pieces of information are monitored continuously during your procedure. So we really do have all of the key pieces of information available to us as they happen during the procedure.
Once we've positioned your TAVI valve, we will take out all the equipment from the access site where the tube is in your upper leg and close that blood vessel with a suture, or essentially a stitch, so that it heals appropriately.
One of the main things that we do before you leave this room is we check immediately the function of the new heart valve using an ultrasound scan of the heart called an echocardiogram. Once we're happy, and we almost always are, we'll then let you recover on the ward, where in time you can have a drink, have some food, and start feeling human again.
As soon as you're back on a ward, we will start weaning the oxygen down, and that usually means your mask will come off. The pain you're experiencing should be minimal. You will have no pain in your heart. If you do have pain, it's not normal. If you have pain in your groin, it should be just minimal from the insertion of the catheter.
The nurses on the ward will be looking particularly at your groin and your leg. They will check your leg for colour, warmth, sensation and pulses to make sure that you've still got a good blood flow down your leg. You will remain on bed rest for the first 4 hours following a TAVI procedure. The first hour relatively flat, and then the remaining hours will slowly start to sit you up.
Once you can sit up a little bit, you can start eating and drinking as normal. And the sooner we mobilise you, so i.e. the 4 hours after the procedure, the quicker your recovery will be and the quicker you can go home.
You'll be attached to the cardiac monitor, which consists of lots of wires all over your chest. The monitor can be seen at your bedside and at the central point on the nurse's station. So if there's any problems, it can be picked up. You'll also have ECGs, which will show the staff what your heart's doing, what rhythm it's in, and if any further action is needed.
Immediately the valve had sort of kicked in and was doing its job. I felt amazing. You know, it was instantaneous. It was like a light bulb moment, as I say.
Some patients feel less out of breath immediately. Some patients, because of the way they've been deconditioned over a period of time, not being able to do a lot of walking or mobilising, for those patients it can take a little bit longer.
The next morning we will come round and review you. We will look at what your heart's been doing overnight, check your ECG, and all being well, we'll be able to remove the heart monitor and you'll be able to mobilise as normal.
We will organise a couple of tests for you. That includes a blood test to check your kidney function and to make sure we haven't lost too much blood during the procedure. And that also includes an echocardiogram, which is the jelly scan you've had before, just to check the heart valve position or any concerns. These tests are usually done in the morning. We get the results around lunchtime and then can start planning for your discharge.
It's possible that the groin could ooze a little bit, or you can get a little bit of a lump called a hematoma. If that happens, you will have our number to give us a call if you're worried, or the number of the ward, but we will give you lots of instructions before you leave as to how you can help and what you can do if you're worried.
Those first 4 weeks, until your body has time to heal, you should refrain from doing any heavy lifting. You shouldn't be bending down and picking any heavy things up off the floor. We ask you not to do any hoovering, not to cut the grass, and not to drive for those first 4 weeks.
I wasn't allowed to drive, I wasn't allowed to do anything basically. So that was probably quite a hard time because I like driving. And my wife hates driving, so the only time we went out is when she wanted something.
All our TAVI patients will get offered a cardiac rehab post-procedure. Some want to wait a little bit longer until they feel stronger. Some want to get moving as soon as they can. This is designed to get you back to your normal activity levels.
If you go to the dentist and you need to have dental work performed, please, please, please ask your dentist about taking a single dose of antibiotics. Now, the reason for that is whenever we have dental work done, small amounts of germs can get into the bloodstream. Now, if you have a brand new heart valve in your body, there is a small but potentially serious risk that these germs can go onto that new heart valve. And that can be reduced significantly simply by taking a single antibiotic.
We are here to look after you. We will be your guidance throughout the whole of this procedure. And really, you can phone us at any time, but we will look after you.
We're associated with a number of companies in terms of trying to advance the technology and advance the valves and advance the procedures so that we continue to strive for excellence and we continue to improve our already very good quality.
I feel generally that I'm getting my life back on track, basically. Yeah, it's I'm very impressed with the op. I think it's done a marvellous job.
TAVI really is a transformative therapy for patients with severe aortic stenosis. It gives you back your quality of life, and in some patients even quantity of life as well. So we are your advocates. We are here working for you in order to access what has become a transformative therapy.